Okay, welcome back to another Minute in the Clouds with Greg. And if I'm not mistaken, this will be day 24. And today I'm continuing talking about depression, more specifically, what is treatment-resistant depression, which is something that I have. And I've entitled this one, Your Guide to Treatment-Resistant Depression. Introduction to this, treatment-resistant depression refers to depressive symptoms have not responded well to treatment, and it makes it particularly difficult to manage symptoms for people who suffer from that. And it's estimated 50 to 60% of patients don't experience positive results from antidepressant medications alone. So it highlights a serious concern. First, if you like the videos and the articles, please consider subscribing to the channel and the newsletter. Leave a comment with any feedback or suggestions of content that you would like to see, and I'll do my best to accommodate that. Again, this is the third part of the depression series. So treatment-resistant depression. Excuse me. Depression affects a lot of people, and there's a lot of different factors for that. But with treatment-resistant depression, there's varying levels of resistance, if you will. Some people with treatment-resistant depression are affected much worse than others. It can impact some people's lives worse than others. But researchers are working on classifying those different things, and more testing is needed. But in any event, there's some treatment studies. There's a lot of studies have been conducted, and there's ongoing research being carried out to try and understand how the different treatments will work. And so what I thought was interesting, and I think I've lost my my page that I was going to do, but that's okay. So some of the treatments that have been tested include ketamine therapy, which I mentioned yesterday. Ketamine therapy uses either intravenous IV doses of ketamine, which is safe and effective in treatment for treatment-resistant depression. Or there's a brand name called Sparvo or esketamine, which is a nasal spray. Usually ketamine infusions are not covered on insurance, but sometimes the nasal spray is. Electroconvulsive therapy, I talked a little bit about that yesterday as well. Electroconvulsive therapy is recommended by the American Psychiatric Association as a treatment for refractory depression, which is just another name for treatment-resistant depression. It's considered to be safe and effective. Quite a controversial treatment, but a lot of doctors advocate for it. I've had it. I believe it saved my life when I had it. And so, yeah, that's indicated for the treatment of treatment-resistant depression. Another one is I can't even pronounce the name, but it's a hormone, basically, treatment. And it's produced by the thyroid gland. They found that augmenting medications with that, adding to medications can help. TMS, or transcranial magnetic stimulation, is another thing that I've had. And that studies are being conducted and have been conducted about the use of high frequency, repetitive magnetic stimulation for an intense treatment for resistant depression. And then there's other augmentative treatments. Quatafine augmentation is a add-on to an antidepressant for treating. Another name for it is Seroquel. Seroquel is a lot easier to say. There's been a lot of research with Seroquel. It's an antipsychotic medication used for various mental health conditions, oftentimes schizophrenia or bipolar. But that's been explored as a treatment, for helping treatment-resistant depression. And then there's the compound that Physolin, I can't say it, I'm sorry. but it's the compound that's found in magic mushrooms, and they've isolated that compound found in a certain type of mushroom, and that's metabolized by the body, the active part of the drug, and it's been found to be quite a potent treatment for resistant depression. Studies are ongoing with that. There have been several studies done, but more are being done. And then there's vagus nerve stimulation. That's a medical procedure. It's been studied at length as a possible treatment. Vagus nerve stimulation shows promising results in clinical trials, and some patients have experienced significant improvements, but more research obviously needs to be done. Then there's bupropion, opioid modulation. With this particular compound, it's been studied as an add-on treatment. And that I'm going to have this all on the website, so there's evidence for this treatment. Studies suggest that the opiate receptors are densely distributed across the cortical areas involved in stress response, and subcortical areas involved in emotion regulation, and they think that this could be a treatment. Scopolamine, which is widely studied medication, they use it for severe nausea after surgery. It's a little patch that goes on your ear, and that's been studied as a possible treatment. And then there's the role of glutamate and glutamine, reduced levels of glutamate and glutamine in the prefrontal region, and the lower levels of the GABA have been found to significantly be significantly associated with major depression and treatment-resistant depression. They're neurochemical. There's a neurochemical imbalance that it plays a quite vital role in developing resistance to medication. This can help, so they say. Then there's deep brain stimulation. Has also been researched for unipolar and bipolar depression. There's a high frequency electrical stimulation, and they direct it to a specific area of the brain using electrodes, and the electrodes are connected to a pulse generator inside your chest, and it sends those impulses, deep brain stimulation. It's currently used to treat Parkinson's disease and other movement disorders, and medication or refractory obsessive compulsive disorder. But there's a good article over on the National Institute of Health, and I'll put that on the website as well. On the article, it's much easier for me. I did have some study materials, but I seem to have deleted them. That's the thing when you've got a brain injury and ADHD. The best laid plans of mice and men, as they do say. You can be prepared for something, but at the end of the day, hey there, orbs, just come onto the screen. You can plan all you want, but at the end of the day, it's just going to go the way it's going to go. So, yeah, but a little bit about my journey. I started with depression in my teen years. It's been very severe throughout my life. And some of the research, and I'll talk about it tomorrow maybe, has suggested that people who are resistant to medication have a higher overall cost on the healthcare system, but also more suicide attempts, and more likely to abuse other substances, comorbid things as well. More likely to have sleep problems, more likely to have stress and anxiety, and certainly can relate to that stuff. Yeah, thanks, Orbs. My friend Orbs, who does a wonderful broadcast every day on TBI, is in the audience. I'm so glad you're here. But you know, genetics plays a big part of it as well, and unfortunately, there's a genetic element for me as well. My grandmother actually killed herself, committed suicide, and so did my cousin. and I've attempted it several times myself throughout my life for different reasons. I've tried the electroconvulsive therapy, the transcranial magnetic stimulation, ketamine therapy, every medication out there, different kinds of therapy, CBT, DBT, EMDR, trauma therapy. It's, you know, it's difficult, but, you know, don't lose hope, because there's all these new treatments being tested and they're refining them. And some of them work in combination with one another, and you know, it doesn't mean that they're not going to find a treatment that doesn't work. So I'm still kind of hanging in there. So if I can, you can too. But yeah, sorry, I thought I was better prepared. I thought I had my research stuff there, but I don't. So what I would say is thanks for tuning in. I hope you enjoyed today's content. Leave a comment, and yeah, we all need to fight on. That's right. Yeah, fight the good fight. You matter, and never forget that you matter. So thanks. I love you all. I'll see you again tomorrow. And as always, please take care of your mind. Bye for now.